afternoon. My name is Michaela Etheridge and I'm a student nurse at the University of South Alabama, and I will be performing a wet to dry dressing change today. So the first thing I'm going to want to do is verify my patient order. I'm going to want to verify my hospital policy, and I'm going to want to get all of my equipment ready for today. Then I'm going to perform hand hygiene. And I'm going to verify that this is my patient using two identifiers. So this is Mr. Jaguar Jones, and his MR number is 417-6352, and he's allergic to penicillin. So everything matches up on my patient care form as it does on my patient's wristbands, so I can begin. First, I'm going to talk about the procedure to the patient to relieve them of any anxiety and just to make sure that Mr. Jones is comfortable. Then I'm going to close a curtain or anything like that just to provide privacy and make sure Mr. Jones feels good about about the procedure. Then I'm going to position my trash can beside me or in front of me so that when I have to throw something away, I will not break sterility by turning around. Then I will perform hand hygiene. Next, I'm going to raise my bed so I can work adequately, and I'm going to lower the side rail. Then I'm going to position Mr. Jones in a comfortable position. This wound is on his hip, so he will probably most likely want to be on his side for this. Then I'm going to put on my goggles. I do not have goggles here with me today, so I'm using my glasses, but normally in a hospital setting I would have goggles. And I'm going to put on my clean gloves. After I have applied my clean gloves, I'm going to expose the wound and the suture and just get the gown out of the way to make sure that it's not touching anything or breaking any sterility. Then I'm going to remove the old ABD pad and tape by gently pulling the tape towards the wound and turning it away from Mr. Jones's body, and remove the inner gauze as well. And I'm going to assess the drainage on here using Taco. So the type, the amount, the color, the consistency, and if there's any odor. Then I'm going to remove the inside gauze and place them on the old ABD pad. And I'm going to assess the wound. I'm going to assess the size, and I'm going to assess the tissue using percentages. So a percentage of granulation, which is the pink healthy tissue that we want to see, a percentage of slaw or necrosis, or if there was any odor. I would then palpate the peri-wound to make sure that there's no heat, redness, swelling, or pain for the patient, because that would indicate an infection. Then I'm going to dispose of the old ABD pad and gloves down towards the trash can. Put them in the trash can. The next thing that I'm going to want to do is get my sterile field ready. So I'm going to open up my dressing change tray, and I'm going to remove my sterile field, only touching the 1-inch border and laying it flat on the table. The next thing I'm going to do is dump all of my stuff into the middle of the sterile field, making sure that everything is well away from the 1-inch border. Next, I'm going to get my normal saline and check the expiration date. Since the expiration date is good, I'm going to pour it into my basin by palming the label opening it up and keeping the top up and slowly pouring it into the basin so no splashback gets onto the sterile field and breaks sterility. I will put the top back on and set the normal saline to the side. The next thing that I will do is donning my sterile gloves. So I'm going to get my sterile gloves. I'm going to open them up away from me. And I'm going to open up the packaging, making sure not to touch the gloves and only touch the packaging. First thing I'm going to do is put the glove on my dominant hand with my less dominant hand. I'm going to grab only the inside, keeping the gloves up and away from me, only touching the cup. Next, I will put on my less dominant hand, keeping my thumb up and grabbing with these hands. So next thing I'm going to do is put it up and away from me and fix. Then I can fix with my fingers. And make sure to keep my hands above my waist. This table is below my waist, so technically every time I reach down to grab something, I am breaking sterility, but it's the only table I have, and so normally in a hospital setting, I would have a higher table, and I would make sure not to reach across my sterile field or turn away from it. Next thing I'm going to want to do is separate all my things out onto my sterile field, but without touching the 1-inch border or leaning across my sterile field. Then I'm going to put my gauze into my normal saline solution. After I have my gauze in my normal saline solution, I'm going to assess the suture wound. I'm going to assess the suture wound by looking at the size, looking at the approximation of the edges, and to see if there is any redness or drainage. Then I'm going to clean the suture. I'm going to clean from least contaminated to most contaminated with one of my normal saline gauze pads. I'll wring it out, making sure not to touch the patient with my glove. In one swipe, I'm going to clean the middle, throw it away, wring it out with one clean swipe, the right side, and throw away. And then lastly, with one clean swipe, the left side, and throw it away. Then I will take a dry gauze, a dry sterile gauze, and gently pat the suture wound dry and throw that away. Then I'm going to go to my wound. So I'm going to take my gauze and I'm going to wring it out, and I'm going to fluff it out and put it into the wound until the wound is filled up, but not so much that the wound is tightly packed. So wring it out and fluff it out. Let's put it in the wound. Next thing I'm going to do is take a dry, sterile gauze and lay it on top of the wound. And I'm going to grab my ABD pad, only touching the outside where the blue line is and laying it onto the wound where the inside only touches the patient. Now I'm going to remove my sterile gloves. So I'm going to grab this outside and pull it off, put it down towards the trash can, and then I'm going to do skin to skin, pull it off into the trash can. Then I'm going to tape my ABD pad down using my tape. So I'll measure. I'll tape down all 4 sides. And tape down the ABD pad. After I have the ABD pad taped down, I would grab another piece of tape, normally in a hospital setting, write my initials, the date, and the time on it, so the next nurse that comes in will see when the last time this dressing was changed. I will then put the patient's gown back down, put them into a comfortable position, and I will lower the bed and raise the side rail so that the patient does not fall or anything like that. I'll make sure that the patient has the call light and is comfortable where they are. After I've done that, I will do hand hygiene and dispose of all of my trash. So once I have disposed of all of my trash and performed hand hygiene, I may leave the room and go document everything that I learned. So I'll document all the drainage on the ABD pad, the granulation, the necrosis, everything like that inside the wound and the size of the wound. I will also document the suture, so the size, the approximation of the edges, and if there was any drainage. And I will also document how the patient did with the procedure. And then I will go about my day.